My name is Jeff Puma. I am the Director of Marketing and Communications for AME. And on behalf of the association, I want to thank everybody for joining us for this webinar, OSHA Guidance for COVID-19. Before we start, I want to remind you that the 36th Annual AME International Conference is this October, the 27th through the 29th. And we are virtual, so you'll be able to join us from wherever you have internet access. You won't have to deal with any additional travel cost or time away from your work or your home. Plus, we have about 40 hours of content, over 40 hours actually, that will be available live during conference week, and then most of which will be available on demand for 6 months following the conference. You can learn more about the AME International Conference and register at ame.org/conference. Today's speaker is Holli Singleton. She's Assistant Director of Environmental Safety and Health Services at NC State Industry Expansion Solutions, or IES. Before joining IES, she spent 14 years in the private sector managing the corporate safety program for a large healthcare system. Her responsibilities included ensuring compliance with a variety of regulatory entities, including OSHA, EPA, DOT, NFPA, and others. Her professional experience includes the investigation of work-related accidents and injuries, emergency management, incident command, and the development and implementation of processes designed to reduce or mitigate identified safety risks. She holds a bachelor's degree in health education from UNC-Greensboro and manager of environmental safety and health certificate through NC State University. Before I hand it over, just a quick few housekeeping items. You'll be muted throughout today's webinar. We encourage you to put your questions into the Q&A box at any time, and we're going to try to take those as we go. So if questions come in there or through the chat, I'll be monitoring them, and I can interrupt Holli and make this a little bit more interactive. We want to make sure that you get out of this what you need as participants. You know, we want to make sure that we answer those in real time and try to help you out with the specific needs that you have and the specific questions that you have. Now I'm pleased to introduce Holli Singleton.
Excellent. Thank you so much, Jeff. And I'm going to do a little screen share action here. Again, my name is Holli Singleton, and I'm delighted to be with you guys this afternoon. I am in North Carolina. So in North Carolina, it's actually 1 o'clock this afternoon. So we're a little bit ahead of you guys. I want to make sure that what we do today is beneficial to you. So Jeff was saying, you feel free to pop those questions into the Q&A. He'll be monitoring that and will interrupt me whenever needed. So I'm hopeful that you all can see the screen that I have shared. It's got the title slide, OSHA Guidance During COVID-19. Now our focus today, you know, we don't have a lot of time, so I'm trying to make this as rich and beneficial for you as possible. So we are going to focus primarily on some of the details that OSHA has to offer related to COVID-19. We're going to look briefly at employee concerns because there have been over 20,000 complaints logged by workers to OSHA that are specific to COVID-19. So as we kind of sort through those complaints and figure out what are people really concerned about, I think there's some beneficial information for workplaces to consider. We will also be looking at risk reduction as well as response plan development. What I'm going to do at the moment, I'm going to try to, I'm going to maybe, yeah. So you guys have access to the chat box, I believe. And I'm going to go ahead right now and put in the chat box a document. Oopsie. Webinar doesn't let me do documents. So scratch that plan. What I will do, I can email Jeff And I could also give you a Dropbox link to documents. Let me tell you what's on this document, and I'm going to pull it up and share it at the moment so you can see it, because just a second, let me do a little pointing and clicking action. Okay, can y'all now see the document on the screen rather than the PowerPoint slide? Is that good? All right, so this document, as we go through the presentation slides, some of the slides will have a little number on the bottom of the slide. That number corresponds with the number on this document. So if at any point we're talking about something and you're like, oh, I would really like more information on that, or I would really like to see, you know, a copy of that particular image that she's got on the screen, the numbers on the bottom of the slide correspond to the links that are in this document. So we'll make sure that you get the document, and that way that you can access the things that you're most interested in. So apologize that I can't share that in the chat box, but one of the downfalls of some of the technology that we're forced to use these days. All right, so let's get rolling. Let's just jump on in. First of all, I do work for North Carolina State University, and my group of folks is a part of the North Carolina Manufacturers Extension Program. So that's kind of our connection with AME. But beyond that, we are also the home of the Southeastern OSHA Training Institute Education Center. And that's really where most of my work occurs. So I'm assistant director with Southeastern OSHA Training Institute. Now that training institute is affiliated with federal OSHA. So I'm not here talking on behalf of North Carolina Department of Labor and North Carolina OSHA, but we're here representing federal OSHA and what they have had to say about COVID-19, especially as it relates to workplaces. So you will see that there are some things going on in OSHA that are related to COVID-19. There are existing OSHA standards that do apply to some of the details that we're having to deal with regard to the virus. So the first of the standards that we have to worry about is that PPE standard. So this is subpart I in 1910. And the questions that we have to consider really center on, you know, do you have workers who are exposed to new hazards? So the requirement of the PPE standard says that you have to assess the hazards that workers are potentially exposed to, and you as an employer have to then determine, is PPE going to be required to protect them from those hazards? And if you decide that there is some risk, there's new hazards because of things going on with COVID-19, and as a result of that, they need to be wearing PPE, then you need to worry about what the PPE standard says. And the PPE standard says you have to conduct this risk assessment and determine in writing, you have to have, you know, an assessment in writing of what the PPE is going to include, what's going to be required. Now, point of clarification, a fabric mask that has been talked about a whole lot, and a lot of states and municipalities are requiring the use of a fabric mask. That is not PPE. So that's a little bit confusing to a lot of people. So when we're talking about our workers exposed to new hazards, it's not really, you know, yes, they're exposed to the virus, unless you are in a healthcare facility where, you know, clearly it's a risk. But in terms of your public exposure, we don't consider that PPE. Now you'll see at the bottom of this slide, the number 1. This is what I'm talking about with regard to that document. So there's an OSHA enforcement memo that an enforcement memo tells OSHA compliance officers, here's how you evaluate compliance with this. So there is an OSHA enforcement memo that is specific to how COVID-19 hazards are evaluated. So if that's something that you're interested in taking a look at, it'll be on that document. The second OSHA standard that we need to be concerned about is the HAZCOM standard. And this is because you may very well have kind of beefed up your cleaning and disinfecting. And if in doing that, you have workers who are using new chemicals, if you're familiar with the HAZCOM standard, it says, when there is the introduction of a new chemical hazard, then we have to evaluate that hazard, and then we have to provide appropriate training to the workers related to how that chemical is used. So again, all of that is in the HAZCOM standard, so it does apply, especially if folks are using new chemicals for cleaning. Now here's the one that really kind of makes people go, oh my goodness, how are we going to do that? And it has to do with record keeping. So if any of you are responsible for the OSHA 300 log, the recording and reporting elements, this is a little tricky. Now here you'll notice we have a different resource. So this is resource number 2 on that handout. And this is also an enforcement memo, but it's specific to how we determine if a COVID exposure and the outcome of a positive test result, is that a work-related concern? So question number 1 is, has the worker contracted COVID-19? And if so, you're going to work that through just like you would any other potentially work-related illness or injury. So COVID-19 cases are recordable if, number 1, the case is confirmed. So this has to be not, oh, we think they probably had COVID-19 because this, and this. It has to be a confirmed case. Number 2, in addition to being a confirmed case, you need to determine that it was indeed work-related. So work-related gets a little tricky. I'm going to share a couple pieces of information about that in just a second. But number 3, it has to meet one of the general recording criteria. And the general recording criteria is, did the worker die? Did the worker miss work as a result of the illness? Did the worker receive any medical treatment beyond basic first aid? So chances are, if it is a confirmed case of COVID-19, at a minimum, they're going to miss some work. So you probably are going to meet the general case recording criteria. So that leaves us back to, is it work-related? Now to determine if it's work-related, first of all, this document, I'm going to go ahead and pull this up so you can see a little bit better what this is going to look like. So did that pop up on y'all's screen, Jeff? All right. So this is a very lengthy, wordy, government-produced document, but I want you to see that it is indeed very detailed. So right here, this is what we just covered. These are the 3 criteria. Has to be confirmed, has to be work-related, has to meet the general recording criteria. Now, if you scroll down the document, and again, this is all about, does it go on my 300 log? You will see right here, it begins information about determination of work-relatedness. So lots of information here that you can scroll through if this is a particular concern that you have. I'm going to go back to the slide now. And let's look at, we're going to kind of squeeze it down because you have access to that big long document, but let's squeeze it down. So to determine if the case is indeed work-related, it is likely work-related if you have multiple cases among your workforce with no other explanation, or there's been known exposure to a customer or coworker. So if you have someone on your workforce that has tested positive, and maybe they got it, in the community, they went, to a wedding last weekend and just had a grand time at the wedding, they come back and now they're sick, right? Theirs is not work-related, but if they come into work and you have 1, 2, 3 people, all of a sudden they now are testing positive, You have to consider what's the probability. We had known exposure to someone in the work environment. Then you've got a case that's probably considered work-related. And then the last bullet point on the screen, if you have workers whose duties require them to be in contact with the general public in an area where there is known community transmission, then their contact with the public as a function of their job would make it likely work-related. I'm going to pause and just make sure. Any questions so far? All right.
There's a question in the chat,
Sure.
but it's very similar to what you just covered, I think. So I just want to make sure that we did cover it as it's asked. So is it still recordable if it is discovered after the fact that it possibly could have been work-related? An example, employee A was out sick for a while, find out later that he tested positive, but employee B was out at the same time and tested positive. Both employees worked in the same area, but the correlation wasn't found out till later.
Yeah. So with OSHA record keeping and the rules that apply to the 300 log, you need to put something on the log once you are aware. So just because you're not aware that an illness or injury of any type was work-related until later, you do have to go back and add it to the log once it's discovered that it was indeed work-related. Other questions? Looks like we got a new. So thank you. Thank you for the thank you. All right, on the screen right now are a couple of other bullet points that do come from that same document, the same enforcement memo from OSHA. So it's not likely work-related if you have information that tells you, they probably got it from the community, or they probably got it from their family member. So if you have that type of information, then it's considered likely not work-related. If you have any questions about that, I would say do not hesitate to reach out directly to your OSHA contact. Hopefully you guys know how to get in touch with OSHA. And I do want to encourage you not to be afraid to get in touch with OSHA. They're generally very helpful with answering your questions. All right, the last standard that we have to consider when we're looking at what does OSHA have to say about COVID-19 is that pesky general duty clause. So the general duty clause essentially tells us that regardless of what details are pinpointed in the OSHA standards, if you are aware of a hazard, you have to protect your employees from it. So even in the absence of an infectious disease standard or specific COVID-19 standard, we do know that there are situations where exposure to COVID-19 is a recognized hazard in the workplace. So we need to be aware and do what has to be done to protect workers. All right, now that was all from federal OSHA. And I did want to just point out to you that if your state has a state plan, they can decide to be more stringent. And the most popularly talked about state in this realm is the state of Virginia. They launched a temporary standard in July. And right now you can go to their website. It is included in your handout. And you can look specifically at the details that they are proposing for a permanent standard for infectious disease prevention specific to COVID-19. And that standard is set to go into effect at the end of January. That should be 2021 on the slide. So in the end of January 2021, Virginia will likely have a permanent standard in place for COVID-19. And it's more stringent than we've been here in North Carolina. It's pretty detail oriented. All right, so when you are the employee, we need to consider, where are they with this? Because we as employers, if we're focused on, well, here are the things that we're supposed to be doing, we have to do, and we're gonna put these things in place, we need to kind of take one step back and ask ourselves, what are the concerns of our employees? And do they feel like, you know, they're being protected? Well, the best place we can go for that is to the data. And I'm going to show you this. This is not on your handout. So if you get your hands on that list of resources, this resource is not on there, but I want you to see where this data came from. So far, from the start of all of this to current, there's been more than 26,000 employee complaints. Now, this pie chart represents the most recent 2-week period. And so when you take those approximate 300 complaints and you divide them into categories, what we're seeing is the largest concern is that workers don't feel like their employer has a plan. They don't feel like, you know, everything is being considered and taken care of. So you can see the other 4 categories, but I am going to show you where this comes from because you have access to it. So this is on the Freedom of Information Act page. And you can see the URL. It's very easy. The URL is osha.gov/FOIA. And if you scroll down, sorry about that, all of that mess. You scroll down, you will see weekly OSHA COVID-19 complaint data. And it's here now because it's frequently requested. So it's not always at the top of the list, but it is currently at the top of the list. So your weekly data, you can look at any of these 4 items. So these are open complaints, these are closed complaints. And when you look at the complaints, oh, I forgot, they have to, whoopsie, download them. Let me open it really quick because I think you'll enjoy seeing the detail, just to give you a sense of what's on here. Now, what I'm going to do, I'm going to scroll over on this spreadsheet to this last column, and I'm going to make it a bit larger, hopefully. So over on that last column, whoops, that's one thing. This is what people are complaining about. So this, number 1, my employer is not following the guidelines. Number 2, we were issued masks one time back in April. Nothing's happened since. And then number 3 is pretty long. The list, you can look at it. I'm going to scroll down, you can see some others. You can look at it by state. So it does have the company name and it's got the company address. So this is all, you know, Freedom of Information Act, but you can see what people are concerned about. And I think it's been very helpful for me to kind of get into the heads of workers and just kind of figure out what the problems are. So again, that's osha.gov/FOIA, FOIA. Right? So we know that we have some risk and we know that we are responsible for the safety of our workers. So now what do we do? What's kind of the next step? I'm going to talk a little bit about risk reduction. I want to start with the hierarchy of controls. So this is classic. Thank you for putting that link in chat, the link to the FOIA report. The hierarchy of controls applies all the time, and this situation is not different. So if you're a safety person, if you're responsible in any regard for safety, then you're familiar with the hierarchy of controls, which tells us once we've identified a hazard, the first thing we need to do is look for ways that we might be able to eliminate that hazard. Well, we're probably not going to be particularly successful at eliminating, you know, the COVID-19 virus. It's just probably not going to happen. So then we move down to engineering controls. We can't eliminate it. Can we separate it somehow from our workers? So isolation in terms of, you know, engineering control, in terms of isolating the worker from the pathogen, a lot of different approaches being used. We're going to look at those in just a second. The next thing we do, if we can't get the virus under control totally through engineering controls, then we ask ourselves, are there other things that we could do? Are there policies and procedures that we could put in place? And the answer is yes. And then the very last thing we do is related to PPE. So the important element of this is you don't start with PPE. So once you've identified a hazard, you don't go directly to PPE. You have to consider, are there ways to eliminate, engineer it out, or other administrative controls, and then whatever's left over, we're going to deal with using PPE. So classic engineering controls for manufacturing plants. Now you'll see here we have resource number 4. Resource number 4 is a PDF of this image. So if this is something that you think would be helpful to have, you'll have it on your resources. And tell you what, we can do this right here. Are you able to grab that, Jeff, and put it in chat, or do I need to do that?
I think you need to do that.
I can do that. I can do that.
That's going to be too hard for me to type out.
There you go, because I can grab it. All right, so that is now in the chat session if anyone wants to grab it. But essentially what this image is trying to convey is there are ways that we can do distancing in a manufacturing plant. And you've got 3 good options described on this image. And then you've got that bad one, the one with the red line. You've got less than 6 feet between workers, both horizontally as well as across that production line. When you get into the good options, you're going to have 6 feet distance. You're going to have partitions, the physical barriers, and of course they'll be wearing masks. So the safe distancing in manufacturing is kind of step 1 for the engineering controls. Other things though, with regard to engineering controls, some of you may have manufacturing plants where workers are used to having fans, just the portable fans running because plants can sometimes be hot and stuffy, generating heat. Be aware that you're not blowing across workers. So if you have 4 workers that are working in close proximity, maybe you got them 6 feet apart, but if a fan is positioned here and blowing across those 4 workers, then the distancing isn't really going to be helpful because that fan velocity is going to push any of those potentially infectious droplets across the breathing zone of all of those workers. So be mindful of how you are using and positioning fans. Hand washing stations and sanitizer are recommended and recommended to be available quite frequently, and not just in one spot, but position them throughout the work environment so people can frequently be cleaning their hands. Areas in your workplace where people gather, those have to have some pretty special attention. So whether it's where people are clocking in and out, if you've got a station where they have to log in and out of work, try to ensure that they're not gathering, that they are still maintaining the 6 feet of distance, as well as break rooms and meeting rooms. So it's generally acceptable to allow people in break rooms and meeting rooms as long as you're abiding by any of your local ordinances that may specify how many people can be in one space at a time. And then even if there are that many people or fewer, they still have to maintain the 6 feet distancing. Any questions related to engineering controls? All right, I'm assuming no. I think what I'm going to do, I'm going to open the chat window so I can keep an eye on that better. All right, administrative controls is the next step. And here, gosh, we've all been to the grocery store. So we have seen some of these in place. You've got your visual reminders. So visual reminders would be signs, posted. I know when I go into the grocery store, there's a big sign that says you must wear a face covering. You also have the signage on the floors that indicate the 6 feet distancing. some of these approaches need to be used in the workplace also. Another thing to consider is your leave policies and your sick time policies. We need to be very aware that workers aren't afraid to take time off. So if they are sick, and it's been a classic American mindset that I can't take time off for being sick because either number one, I won't get paid and I need my paycheck, or number two, I'll get in trouble for missing work. So we really need to correct that mindset, because the last thing you want are workers coming into your workplace who are potentially sick, and then they spread that virus, and now you have a multitude of people infected. It's not going to be, you know, a happy scene in any regard. So I want to pose a question and just kind of let you respond in the chat session. Are any of you, just respond yes or no in chat, are any of you doing health screenings? Are you taking temperatures or, you know, asking questions of, you know, people as they arrive to work? I've got one who says yes. And to answer the question, it looks like last name Jacobs asked the question about a copy of the presentation. Yes, I will definitely provide that. Or Angelina Armour says, yes, you're doing some screenings, as is Heather Campbell. I'm going to do this. I am allowing everybody to talk. All right, I have clicked on, you know, giving permission for you guys to talk. I would love to hear your thoughts on how those screenings are going. If anyone's willing to unmute and just share.
Ours seem to be going pretty well. We screen our employees with temperatures every day. And our vendors and any remote employees that aren't here every day, we screen them at the guard shack, as in every 2 weeks they're required to complete a questionnaire. And that's how we've been doing it here.
Yeah. And do they seem to be pretty receptive to that? And
yeah, it's been going pretty easy.
Yeah, good. Excellent, thanks. Anyone else have experiences with the health screenings?
This isn't work related, but even my daughter's soccer team, the app that they use to do their practice schedules, before they're allowed to practice, they have to go through a health screening questionnaire on the app, and then they take their temperature when they get to practice. So,
yeah,
you know, it's interesting that it's even in our personal lives and home lives.
Absolutely. And I've got a comment in chat, use screening questions and thermal cameras for temperature monitoring. Anybody have any feedback on how accurate those temperature screenings have been? Because I think most are using, you know, the thermal scanners, whether it's a forehead scan, or I think I've seen some others that were on the carotid artery area. You have any feedback on accuracy?
We've been using infrared scanner gun, and sometimes it can be fairly close. Sometimes it could be 2 or 3 degrees off.
Wow.
It kind of depends on battery power. Recently, we actually just acquired automated screeners, which will be screening by the wrist. And we should.
Okay, so that's a wrist.
Yeah.
Yeah. Thanks, Heather. Excellent. Anybody else have things you're doing for screening that you would be willing to share with everyone else? Anybody have workers that are now working from home? They used to work in the office, but now they're telecommuting or working from home instead. The recommendation from CDC as well as OSHA, and I will say OSHA very regularly defers to the CDC on some of their recommendations. And the recommendation is if a worker can work from home, and accomplish their assigned duties, then they're recommending that employers allow that and make arrangements for it. So where it's possible, they'd like to see that. All right, let's get into something else. It's a little bit, I don't know, people are a little confused and a little concerned about kind of PPE and what it all means and what it means to the employer. So I do want to spend a little time on cloth face coverings as well as respirators. So right now what we're dealing with is cloth face coverings being required by many states and municipalities. But technically cloth face coverings, that's hard to say, cloth face coverings are not PPE because PPE is personal protective equipment and cloth face coverings are public health protection. So that's a very different category. Now, what that means to you from OSHA's point of view is when something is required to be worn by a worker and it is PPE, it's personal protective equipment, then that brings with it some responsibilities on the employer side that are not in place if what they're wearing is not PPE. So it's really important that if what your workers are required to wear is a simple cloth face covering, and the purpose of that face covering is to protect their co-workers, then that is not PPE. Now you'll see here we have resource number 5. This goes to an OSHA webpage with frequently asked questions, and it is a very rich webpage. So there's going to be just a plethora of questions related to COVID-19, and we may as well take a trip. Let me go ahead and show you what it looks like. So again, on the document that you will get, this frequently asked questions, you're going to see questions related specifically to cloth face coverings, and then a whole nother section on PPE. And when you click on these, any of these topics, it's going to take you to a list of questions. So we don't need that one open. Are employers required to provide cloth face coverings? Well, here's what I was just saying. They are not PPE. So they're not intended to be used as PPE. But then it goes into, we got the general duty clause, and employers may choose to ensure that they're worn. So the fact that cloth face coverings are not PPE puts them in a whole different category, and it's not monitored in the same way by OSHA. Now, here's another frequently asked question. What's the difference? But we got cloth face coverings, we got surgical masks, we got respirators. What makes them different, and how do I know which one is going to be the most appropriate? So again, that is resource number 5 and will be on your handout that you get. It's a very, very good website with lots of questions even beyond cloth face coverings and PPE. Right. Now, cloth face coverings, we've already kind of touched on this. I do want to ask the question, and you can respond in chat or you can respond back at me live. Are you as an employer providing cloth face coverings or masks to your workers? Or are you just allowing them or having them provide their own?
For us, some of them like to get their own, but we do have cloth and paper both available should they want one from us.
Okay, so excellent. You're kind of giving them the option there. Anybody else? Are you providing or just? All right, so I know that you have workers wearing them. Just be mindful that, whether it's a cloth face covering, surgical mask If they're being worn as cloth-based coverings, that's fine. But if they're being worn as a function of like a healthcare job, that's different. So if any of you are in healthcare, you've probably got workers who are required to wear surgical masks. That's a little bit different application than wearing a surgical mask as a cloth face covering for the purposes of COVID-19. And then we have a whole new category that is respirators. Now, respirators are different. And this one, we just need to talk about a little bit. So when your mask is technically a respirator, it falls into a whole new category. So how do you know if it's a respirator? You're going to know because it has the NIOSH symbol. So I've circled it here. And if the mask has the word NIOSH on it, that means it's a respirator. Well, if it's a respirator, it qualifies as PPE. Even if the worker is wearing it simply instead of a cloth face covering. So if you're providing N95s in response to COVID-19 and people can choose between wearing a cloth face covering versus the N95, you're in a little bit different category because the OSHA standard says that if people are required to wear a respirator, then the employer is required to meet some elements of the respiratory protection standard, even if it's not being used because of a respiratory hazard. So I'm going to leave that there. I don't want to go into a lot of unnecessary detail. Let's do this. I'm going to put, and my email address will be on the materials that you get, but I'm going to put it in chat. If you're concerned about what you're providing or requiring your workers to do, and especially the question being, is there an OSHA standard that you have to worry about? Don't hesitate to send me an email. I will go ahead and put this out there. I may forward your email to a colleague because we do have a number of people on our staff, some of whom are extremely well versed in respiratory protection and may be able to answer your question more effectively than I would. So don't be scared if I go, ooh, I'm going to get so-and-so to answer your question, just trying to hook you up with the best person possible. But be mindful, if you are providing masks that have the word NIOSH on them, that's a little bit different ballgame. All right, any questions at this point? All right, we covered all of that. We're not going to go any further into it. All right, so here's the bottom line. Your cloth face masks are designed to protect other people, and your respirators are designed to protect the wearer. So that's kind of the bottom line, and the requirements are different. So just make sure you're clear on that. That resource number 5 is extremely helpful if you have specific questions. Now here we're going to get into cleaning and disinfection. This is resource number 6, and it's basically the guidelines straight from the CDC. So when you are developing a cleaning and disinfecting process for your workplace, make sure you're paying attention to what these guidelines are suggesting. So step number 1, figure out what is it that you need to be cleaning, what areas need to be disinfected, and kind of what are your resources, and resources in terms of who is going to do it, do they need PPE because of any chemicals they may be using, and also resources in terms of that PPE. What do we need to provide them with regard to the cleaners, the PPE, and any training that those people need. Implementation of your plan is number 2. So make sure here that you are choosing the right things and you are doing your process based on what the CDC is recommending and following the information on the label of whatever cleaning supplies you're using. And then step number 3, keep it up. Do what you need to do to maintain that process. This is resource number 6 from the CDC, and I think you'll find lots of really good information. It's also on the CDC website. Their information is really easy to digest. It's not like that OSHA enforcement document I showed you. It's very well designed and easy to discern what you need to know. When we looked at the complaints, when I showed you that initial pie chart, the biggest section of that piece of pie is employer planning and protocol. My employer doesn't seem to have their arms wrapped around what they need to be doing. We don't have a plan at my work. I'm concerned that we're not being protected because no one's really paying attention to what they need to be doing. So that was almost 50% of the complaints. So this is a real easy thing to address because all an employer needs to do is develop a plan. And it's not that difficult, and we've got some resources for you. So step 1 of developing the plan is figure out who needs to be on the team. And that might be any safety personnel, probably someone from HR, because there's some HR related issues when you start dealing with protecting workers, especially as it relates to sick time and having to put someone out of work temporarily because of an infection. So safety, HR, and I would definitely want to have someone from your leadership team as well as 1 or 2 representatives from your frontline workers, because they really do need to be connected to this plan and make certain that you're getting their input on it. Number 2, you write the plan. And then number 3, you're going to strategize. Now here we're going to go, okay, we got this lovely plan and on paper it looks great, but how do we make it come to life? How do we take our ideas that we feel like are the answers to these COVID-19 issues? How do we bring them into reality and make it work? So that's your strategy portion. And then number 4, you're going to move forward with it, understanding that it's a constant. You're going back and going, okay, what do we need to be doing differently? What's working well? What do we need to consider next? What's our next steps? So moving forward also means to be reflecting on how can we do this better as we move forward. There is an excellent checklist, and I do want to show you this. This is resource number 7. This is a really, really, really good checklist. And I cannot share this with you as a website because it's just not available like that. But I can give you a link to the PDF, and that's on your resource list. So this is fabulous. It was designed by the CDC in cooperation with OSHA, and it helps organizations, manufacturers in particular, to do this assessment and plan development. Now, it is a downloadable PDF, and you fill it out for yourself. This is not something that gets turned into OSHA. This is an internal document for you and your organization. You'll see it's brand spanking new, dated June 19th, 2020. So it walks you through the assessment steps, and it's asking you all the right questions that you and your team would need to consider. It's about 7 pages in length, so it is pretty comprehensive, but it definitely addresses all the elements that you would need to pay attention to. So again, that is resource number 7 that will be on your resource list. I think you'll find it incredibly helpful if you feel like, hey, we need to be paying closer attention. Or maybe you've done what you feel like is a really good job of developing a plan. It's still a great resource for you to look at and go, okay, did we miss anything? Is there anything that we need to add to our plan? Returning to work post-exposure. Here's a question for you. I'd love to hear from you, either in chat or out loud. Have you had workers who were infected? Have you had anybody who has tested positive? Do I take that as a no? But that is fabulous news. I'm glad that you haven't had to deal with those things. I do want to point out that on the screen and in resource number 8, these are the CDC's recommended steps for returning to work. And again, the website is really rich. It's got a lot of good information. Resource number 8 walks you through, here's what needs to happen if you have a positive case among your workforce. And it speaks to the length of time for quarantine and isolation and when workers should not be in the workplace. Any questions about that? All right, so in summary, what I have told you was, this was the story as of September 17th, to put this together last week for you guys. So just want to point out, things change. Things are changing constantly. So the recommendations that I've highlighted and where OSHA is with some of these standards and their interpretation of how to apply the standards, effective today, but as this develops and move forward, we may find that things do indeed change. So stay up to date. Use that resource list. Most of the resources are going to take you to websites directly, and that way you can ensure that you're getting the most up-to-date information. But the last few minutes that we have together, I tried to save a little time for any questions that I did not address or anything that you want to share that might be helpful for all of us.
Feel free to use that chat, or you can unmute yourself or use the Q&A box. There are 3 options here. So.
I have a quick question. Earlier when you were talking about fans not blowing across people, were you meaning with or without wearing like the cloth coverings? Like that it negates social distancing practices?
Yes, so if I'm pushing air across a line of workers and that air is blowing across the breathing zone, I do need to be concerned about that. Now, that's not to say that we have to close all the doors and we can't have a breeze. What we need to be mindful of is what we might be doing as employers that increases the risk of exposure. And so if we are pushing air intentionally across the breathing zone of workers, even if they are socially distant, we have to be concerned about that.
And even if they are wearing their mask properly. And
yeah, remember the mask is designed to protect other people.
Gotcha.
So wearing a mask does, unless it's a respirator, wearing a mask doesn't protect me. So if you need the use of fans, which I totally get in many of these manufacturing settings, see if there's a way to set that ventilation up so that it's not across the breathing zone, even though that's where we want it, because the fan feels good blowing across my face. That's where it helps me feel cooler quicker. But if we can do it not across the breathing zone, bring that fan down to a lower level. You check your ventilation system. Is there something you could be doing within your building's ventilation system where it can be a little more controlled, filtered air instead of just circulating the air that's around the workers? It's a tough issue, Heather. Totally a tough issue.
Yeah, it is. It gets pretty warm in here.
Yeah.
So.
Anybody have recommendations that would be helpful to Heather? Have you worked out anything that you could offer? All right, Jeff, it sounds like
We have 2 questions in the chat,
sure.
actually. So,
excellent.
The first one from Angelina is, are there specific guidelines regarding the size of the barriers between line workers?
So when you say the size, are we talking the thickness of the plexiglass or the height and width of the barrier?
It's a good question. Both.
Both. I have not come across a recommendation for the thickness. So I'm not going to say there's not something out there, but I have not come across that. The recommendation for the height really is it needs to cover the entire breathing zone and probably about 6 inches above that breathing zone. So we're really concerned about this area. So if we can go a little bit above and below that, that's going to be ideal.
Okay.
But thickness I'm not familiar with.
Okay, and then there's another question. Any OSHA regs or guidance on employees not following mask requirements implemented by employer, all enforced by employer, or OSHA and or state requirement also enforced?
Okay, so OSHA has nothing to do with your state requirements for the use of masks as a public health tool. So if, like, I'm in the state of North, told that we cannot social distance.
Oh, we're losing your voice there.
Hear me better now? No.
Yep, you're back.
Okay. Sometimes there's a little glitchy technology thing. But in the state of North Carolina, we're mandated to wear the mask as a public safety tool anytime we can't physically distance at least 6 feet. So if we're with other people, physical distancing is not an option, then state of North Carolina says we have to wear a mask. OSHA has no jurisdiction over that particular mandate. However, if you as an employer have a policy in place that says your employees must do something as a safety policy, then you need to enforce that policy. Now, if OSHA were to come in and do a compliance audit and discover that you have a safety policy that you're not enforcing, then that could potentially be cited. It's relatively rare, but it could be cited. But it would not be cited under an OSHA standard. It would be cited under general duty clause, where you have a recognized hazard and you're not addressing it with your workplace internal plan. So I don't know if that was a helpful answer, but it's kind of a very complicated issue.
Very helpful. Very helpful. Got in the chat. So don't see any other questions coming in. But I do want to thank you for doing this. This has been super informative, and those resources that you mentioned and that we'll share through email with the participants will be, just a way to reinforce everything and let them dive in deeply. And thank you for sharing your email address as well.
Sure.
So,
and I will send you, Jeff, I'll send you those two. I'm going to send you a PDF copy of the slides and the handout list that corresponds with what we were pointing out during the presentation.
Wonderful. And I will get that into the hands of everyone who participated today. And really appreciate your time and your dedication to this issue, but then also to helping to share that and spread the message and the guidelines with AME members and the rest of the community. So thank you very much.
You're welcome. I've enjoyed it. Thank you, guys.
And thank you to everybody who participated today. It's great to have people here and to have these great questions, and even as we work through how to make sure everybody's able to raise their voice and be able to share, not just in the chat, but also by talking. So thank you for going through that with us. Lastly, just a reminder, the AME International Conference, you can find out about that as well as all of our other events at ame.org. If you want to go right to the conference, ame.org/conference will take you there. So thank you so much for everyone for participating. Thank you, Holly. And we look forward to seeing everyone at an event soon.
All right. Thank you, Jeff. Appreciate it. Take care.